couple of years ago, a friend suggested I had a PSA test. He had been diagnosed with prostate cancer. Came back 3.6. The following year I went back, so this is January this year, and my PSA level came back at 4.6, which caused a little bit of concern at the doctor's surgery. They referred me on to the hospital where I had another physical test, and I was advised that they had detected cancerous cells in my prostate. We went in and we saw Tim Dudridge, the specialist in the field, down at Southampton. Due to the level of what he had detected, he felt that it would be a good idea to do active surveillance, where I would go back for tests on a regular basis. I felt very early on that I would prefer that if there was cancer there, for it to be taken away so it hasn't got the chance to metamorphosize into something more sinister. Tim obviously picked up that I was uncomfortable just letting things lie. He'd gone through all of the options previously, but this would be the most apt option available to you. And this was HIFU, and it seemed to fit the bill. After listening to what Tim had to say, my wife reminded me that we do have access to private healthcare. So by going private, I was able to get it done quicker and done and dusted and out of the way, which is a lot more comforting on the mind. During the course of the consultation, it did come up to me that HIFU was not offered in some other health areas, and it was offered because Tim Dudridge was one of the pioneers of the system in the UK. In a way, I was lucky insofar as if I'd been in another part of the country, then the treatment wouldn't have been offered to me. He went through what the operation would entail, any relevant side effects, of which fortunately I have none. All my plumbing has come back in full working order, so I'm quite pleased with that. All the way through this process, my wife has said to me, "You didn't know that you had it." I still don't feel as if I've had anything wrong with me. I don't feel ill now. I never felt ill before. And my wife said, how many men are walking around that have prostate cancer that are unaware? If you're the right age, get yourself checked. It may come back that you've got nothing there, but rather that than you've got something there that you don't know about. If I'd been sent away with active surveillance, I would have known that I had cancerous cells in my body, and I would have been very, very uncomfortable knowing that I was in a situation with more or less a time bomb sat ticking inside my body. Not very happy with that at all. I'm so glad that the HIFU option was available to me and I was able to take that.